Hi, it's Angie reporting again from Tijuana, Mexico on May 13th, 2025. I did a video earlier today, talked mostly about the IV treatments at the Holistic Care Clinic in Tijuana, Mexico. I'm here primarily to see Dr. John Bergman. I want to make that clear, but in this video, I'm going to just talk a little bit about the dental clinic that's there. I'm not going to have a lot of experience with that clinic, thankfully, that I don't need some of the work that they do, but I had a dental appointment and cleaning and consultation, and they also do, though, amalgam removals, root canal removals, and they do implants. And I'm not sure if there's anything else, but those are big things, and that's the things that the people I've talked to that are here are mainly here for. It's pretty amazing. The one said he had a whole mouthful of metal to get rid of, all the amalgam fillings, and some root canals, and he did implants. And I thought, oh, that'd be terrible. And I said that I couldn't imagine sitting in a dental chair for that long. And he said he was sitting in that chair for 6 hours one time, and it wasn't bad. They have a vitamin C IV drip going at the time, probably to do with infections and inflammation. And he said it's just no big deal. And it wasn't just him that said that. It was his wife and another woman and her husband all said the same thing. They were all having that same kind of work done. And whatever he does, he's really good at it, and people don't mind sitting in that chair. I can't even stand sitting in a chair for a cleaning, but that's what I did because the dental appointment is included in the $350 package that you can get when you go there to see Dr. Bergman. So I went there to the dental for a cleaning and consultation, and they don't use those sharp, pointy tools. They use something like the tool I have at home, and I've posted about it in the group before, where it just vibrates, and when it hits your tooth it starts vibrating, and then it just makes the plaque fall off, I guess. And it wasn't bad. He doesn't have a spit sink. I didn't understand what he was doing at first. He said, after a bit, he said, close your mouth. So I closed my mouth, and that thing that suctions out of your mouth got stuck to my tongue. And I thought, I wonder what he's doing this for. And then I caught on really quick after that. Oh, when you close your mouth, you're supposed to swish it around and let it suck out all the saliva out of your mouth. And then at the end, and he does it often throughout there, that too. And I wish other dentists would, because I remember being in other dental chairs where you're laying back and I got my throat closed off because you got all the saliva building up in your mouth, and they just keep working away, and I'm almost choking, wishing I could spit all this excess saliva out. But every few minutes when needed, he just tells you to close your mouth and you let it suck it all out, and then he starts again. And then when it comes to rinsing your mouth, he sprays it with water. I guess it was just water. Spray, 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 spray. Then you close your mouth and let it suck out all the stuff, and he sprays again and let it all come out again. So that was pretty cool. He doesn't like spit sinks, and neither do I. Otherwise, I have a filling up here, the back top molar, that has to be redone. And there's a cavity beside it, and I knew that would have to be done. So that's all I'm going to say about mine. There might be a couple other little cavities that I haven't decided if I'll fill or not, because I'm going to possibly try to heal them myself. But if he does do them, he's not going to be using amalgam or anything like that. And like I said, the other people, they're getting all this work done, and it's pretty incredible. He's a good dentist. Nobody, not one of them, has said, oh, it was terrible. I mean, I needed it done, and nobody likes the dentist, so I just sat there to do it. No, they all just said it was fine. And I said, well, did they freeze you with a needle? I don't remember. That's what they said. I haven't had my thing fixed yet, because if you know, and have been listening to my other videos about Tijuana, you'll know I broke my knee. So that kind of held up things like that. That's my excuse for not sitting in the dental chair right now and getting those fillings. I'm thinking I might do it next week. I'll let them know maybe tomorrow. But tomorrow I see Dr. John Bergman. He'll do 4 adjustments on Wednesday, and I'll let him do 4 more on Thursday. I did an interview with him last week where I looked like I was all washed out. It was Thursday. And what a difference. People were telling me today my skin was glowing in my videos, and I didn't think so. But then I got the email about my video with Dr. Bergman being published. It's not on YouTube yet. It wasn't tonight anyway, but it's on his website. I went and looked at it. I looked terrible. It's kind of embarrassing, and it was 2 days after the fall. Wasn't able to sleep much. I was in a ton of pain, and you could tell I was washed out from it. But I've had a lot of IV treatments since then, and chiropractic adjustments, and more sleep, and I do feel and look a lot better now. So I'm kind of hoping he'll do a before and after video, kind of do another one when I've had some more improvement and everything, and people can see that that's not my usual self, the way I looked in that video. But yeah, that's what I'll be doing tomorrow. And I'll try to get him on video again. When you go there and you get a consultation with him, he encourages you to record the whole thing, and I did. But I'm not going to be publishing my personal consultation with John Bergman. It's just personal. It's my own personal medical stuff. And I may, if I have a chance, do some editing and take out a chunk here and there and show it to you. But if you go, you can do the same thing. But I will, I think, have my adjustment recorded tomorrow. I know you can. And I may publish that. I don't know. We'll see how it goes. He can only do so much with me right now because he can't put me on my stomach, only on my back, and can't do anything with my left leg or anything. So he can only do so much. But I'm looking forward to it. And I'll talk more about the chiropractic stuff later, but I wanted to sort of keep one topic per video, and this video is mainly about the dental. And all I can say is it's the best dentist I've been to, but I haven't had to have extensive work. I don't have root canals. I don't have amalgams. The only thing filling in my mouth right now is the one top one, which isn't mercury, but it still needs to be redone. There was damage to that tooth too. Oh, excuse me. I thought it would be a bit late to do a video, but I thought I'd try anyway, and we'll see how it goes. I may publish this or I may not.